اللي بده يجاوب يرفع ايده. شو شايفه؟ كدني؟ طيب is this a normal kidney؟ فيها papillary necrosis. And a papillary necrosis is a complication of an acute pyelonephritis. In this case, this kidney comes from a diabetic patient. And then we can see the pathology that I hope you would discuss in the pathology section. طيب. راح نحكي اليوم على infections of the urinary tract. We, in this system, inshallah, will cover it in 4 talks. Today's talk is more of introductory, so we would understand the natural history of the disease, the epidemiology, and the virulence or virulence factors that pertains a successful establishment of an infection. In the following 3 talks, we'll be discussing in details some of the etiological agents that cause urinary tract infection. Okay? This is the approach. UTI, urovirulence, and obviously the interaction with the host, innate and adaptive immune responses, trying to get rid of this infection. We'll introduce it, we'll talk about the adhesins, the uropathogenic bacteria, and we'll finish with the innate immunity and the urine and bladder defenses. Generally speaking, we are familiar with the anatomy of the urinary tract system. صح? Okay. So which is it more common, males or females, to acquire a urinary tract infection? And there are many reasons for that. احنا لما نحكي urinary tract infection, we're discussing the entire urinary system, صح? Spanning from the kidneys all the way down to the urethra. And for each one of them, there is specific manifestation. In your opinion, which would be more severe? Urethral or urinary bladder infection, or an ascending infection to the kidneys? Kidneys, صح. تمام. And normally, the story starts downstairs in the urethra, and then the infection, if untreated, or if there is an anatomical problem with the urinary bladder, it will become an ascending infection to the kidneys. Okay? Now, on rare occasions, if someone is dealing with bacteremia, and the kidneys could get infected first. Okay? بس احنا بنسميه that kind of scenario we call it a secondary, not a primary UTI. Okay. Is it common? UTI? It's very common. Millions and millions of people are affected by it. Obviously, there are risk factors that we will explore, and there are ways to avoid or be more preventive to prevent UTI. Females, at least once in their lifetimes, they will experience at least once UTI in their lifetime. Okay? Uropathogenic E. coli continues to be the most common. One of your colleagues, I'm not sure if it's yours, probably yours, they were asking me about strep and staph. Why? This is a problem. Why? Because we don't know what's circulating in this community, so we can teach or discuss the common issues in this community. So we refer to textbooks, and in the textbooks we say strep or staph. All in all, for infective endocarditis, strep and staph are the most common, okay? And it depends on the country that we're discussing it in. Now, for urinary pathogenic E. coli continues to be the most common, okay? And it's the most common in community-acquired UTI and in the hospital-acquired UTI. Which one is worse, hospital-acquired or community-acquired? Hospital-acquired is normally worse use. Recurrence, obviously, and interestingly, these uropathogenic E. coli, they are considered part of your normal gut microbiome. And there are some hypotheses about seeding in which the bug successfully arrive to the urinary tract system and establish an infection. What keeps it in check in your gut, the immune surveillance, and the competition with other residents of the gut. Other microbes, yes. So to establish a successful infection, it needs to have the capability to adhere, so it can colonize, so can it establish an infection, and then possibly disseminates, right? And that's normally the story. And along these different stages of establishing an infection, بده يكون في certain properties that make this bug more successful than others in the UTI system in particular. تمام? And that's why we have certain bugs that cause infections in certain systems or certain organs in our body. Okay? They've adapted and they've geared their virulence mechanisms to evade and successfully establish an infection in that particular organ or tissue type. So CD-pores is required, capsule, adhesions, and secretion of some toxins. That's a general statement that pretty much applies in the case of UTI. Retrograde ascending infection. Okay? So retrograde ascending infection meaning what? يعني the microbe establishes an infection ascending through the urethra, to the urinary bladder, to the ureters, صح? And all the way to the renal parenchyma. ليش retrograde ascending؟ لأنه it's against what? The normal flow and production of waste, aka urine, that goes down the ureters to the urinary bladder where it gets stored, and then it passes through the urethra to the outside. مش هيك؟ So that's normally the story. And then we're discussing persistent infections or recurrent infections. And as I said, there are multiple factors that helps the bug to establish an infection. Now we said one thing. We said females are mostly commonly affected by UTI. And you probably already know why. Check. Due to the shorter urethra in female anatomy. صح? A clear point. But this is what we mean by functional and structural compromised UTI or urinary tract. Now, in normal conditions, that's just a shorter urethra in females and causes more infections. But what are we discussing here in terms of anomalies or deformities, okay, that boys or girls alike could be born with, check, and could possibly lead to a more prone or susceptibility to infection. تمام? Normally, احنا, when we see a female comes, so below the age of 3 or 5, if I recall correctly, if anyone comes with a UTI, especially a male, one of the things that we normally do is a bile study or a dye study, عفوا, a cystogram, pyelogram, okay? So we can visualize by dye the entire urinary tract system in this boy because it's rather unusual, okay? طيب. Usually the firstborn boy in the family, if there is anomalies or changes in their anatomy, abnormalities, it will be there. تمام. So before we discuss how a bug can successfully establish an infection, obviously we do have our own host defenses and mechanisms that helps us and protects us from establishing the infection. Because UPC or not, يعني whether it's uropathogenic E. coli or other types, you do have your skin microbiome, you do have your own urinary system microbiome. It's already there and it already exists. So without proper defenses of the host, this is part of the risk factors, and I'll show to you in a minute in a table, تمام? So the first one, the shearing force of micturition itself can help clears the urethra from any possible attached microbes that could lead to the infection. So urine flow. So in our culture, we don't necessarily drink a lot of water. Check. Other cultures, they do drink more water, and the reason behind that, the environment and the culture we live in, اللي هو climate, عفوا, not the culture, the climate that we have doesn't really invite us to drink a lot of water, huh? شو رأيكم? So drinking enough water every day is quite critical, okay? It's critical to many things. One of them is helping the body in a non-immune mechanism. And هون أنا كاتب لكم non-immune mechanism, okay? لأنه the urine itself, other than the physical force and the sheer force of micturition, there is an antibacterial activities in the urine. مثل شو يعني? What do I mean by antibacterial activities of the urine itself? Such as what? pH is 1. Saltiness, acidities, different elements in the urine that could possibly do what? Help clearing the infections. طيب, innate and adaptive immune responses. Which one comes first? Innate immune responses. بالعادة innate immune responses, what are we discussing? شو innate immune responses؟ بشكل عام, generally. شو circulating innate immune cells? Macrophages, neutrophils, مش هيك؟ When they detect something that is not self. يعني it's not expressing MHC class 1. مش هيك؟ مش قلنا the MHC class 1 is your tag? It's your name tag. مش هيك؟ All nucleated cells in the human body عليهم MHC class 1. مش هيك؟ The innate immune system cells, they're surveilling your body. If you have the tag, nothing will be picked up and there will be no reaction. If there is no tag, then they'll be recognized as foreign. مش هيك؟ And then they will invite others to the party through secreting chemokines and cytokines. مش هيك؟ And then the macrophages themselves will try to engulf the invader, the foreign, whether it's bacteria or any foreign. مش هيك؟ And then there is a connection between the innate immune responses, اللي بالuroepithelial cells, that results in pro-inflammatory responses, into the adaptive immune responses, اللي هو cell-mediated mechanisms, through what? Through the ABCs. مش هيك؟ شو ABCs? Antigen-presenting cells. That they pick up the antigen, اللي هو non-self, and then they present it to the B cells and T cells. مش هيك؟ شو هم هدول ABCs? What are the ABCs of your innate immune system? Macrophages, dendritic cells, and B cells. B cells, doctor, they produce antibodies. مظبوط؟ صح. They do produce antibodies, but also sometimes when the inflammation is يعني increasing, they also act as an ABC. And then the ABC takes up that signal, it goes to the surrounding lymph nodes, and then we start seeing what we call colonal expansion, صح? And then we have producing a specific antibodies against that non-self, against that foreign, مش هيك? Providing clearing, long-lasting immune response, specific with memory. Check? With memory cells at the end. This way we deal with the recurrent urinary tract infections. The innate immune responses is general, immediate, it's non-specific, and it's non-clearing. صح? And short. The adaptive is delayed, specific, clearing, long-lasting, with memory. Is that clear? But there is also always an interplay between the innate and the adaptive immune responses when we deal with any foreign invader. Okay? بالعادة the story involves a chemokine cytokine storm that leads to clearing, hopefully, the infection. تمام. But what's new here? The new here is the system itself, the involvement of the urine, the properties of the urine as an antimicrobial, non-immune things, and the physics of it, the sheer force of micturition. The more water we drink, the better off we are in terms of fighting off possible infections. But we invite all of us to drink more water. What's the daily intake recommended for water that we should drink every day? 3 liters. But do we have to drink it all as water? ولا لا؟ يعني from fruits, from bread, from others, صح? All in all, it should be about roughly 3 liters for an adult. So انت يعني if you drink 1 liter of water and then get the rest from your daily diet, it should be enough. تمام? Females and males, all ages, adults and elderly. These are the risk factors for UTI. Previous UTI is a risk of a UTI, okay, among females. And establishing an infection the first time makes it more susceptible for whatever reason, يعني whether it's structural problems, behavioral problems, عفوا hygienic problems, okay? If someone comes to you with an UTI, most likely they will come back again with another UTI, okay? Unless they drastically change their lifestyle and do more proactive measures to prevent it. Surgeries, catheterization. Imagine a urine catheter. It's like a highway for the bugs, مش هيك? It's much easier to attach to the material of the urine catheter than the uroepithelial cells, for example. Check. So once we introduce a urine catheter, we have to remove it within how many hours? It has to be replaced, مش removed يعني. 4 hours, 12 hours. It depends on the healthcare facility and their procedures and protocols. But generally speaking, we're discussing 6 to 12-hour change of the urine catheter. Obviously, to prevent or minimize possible infection, obstructions, stones, cancers, transplant. Circumcision in males, okay. In Western societies, this is something debatable, okay. In our society, it is not, alhamdulillah, okay. Again, catheterization, stigmatization, calculi, cancer, transplant, and so on and so forth, okay. So this is a common, so as you can see, it's a system that is flowing naturally. Anything that disturbs, subhanAllah, that natural flow can lead to bugs takes up the opportunity and establish an infection. All of this, whether it's calculi or cancer or transplant, all of it, including the urine catheter, كلها, it comes to the same meaning, صح? But technically, in the exam, you shouldn't be memorizing this. You should be understanding it. Anything that disturbs the natural flow of things could possibly lead to more susceptibility to UTI. واضح? Okay? Don't memorize tables, please. Female, طيب. Sexual intercourse, new sexual intercourse, multiple partners, lack of intercourse protection, diaphragm use, spermicidal, all of this. ما راح أحكي على pregnancy with diabetes for now. But I'm راح أحكي على the practices here that we see more, alhamdulillah, in Western societies. We don't see this as much here. But all of it leads to the same result. Instrumentalization, introduction of bugs in more frequencies. Despite all the host defenses, it will eventually lead to a UTI. Okay? Okay. طيب. Diabetes to pregnancy. Pregnancy راح أحكي لها حال, بس diabetes, what's with diabetes? Diabetes is one of the risk factors. ليش طيب? The immune system is weakened. Huh? One of the nutrient sources for the bug. طيب. So that's one. And the other one is the obvious one. The immune system is weakened. لما نحكي diabetic نحكي إنه the immune system is weakened. مش هيك؟ You agree ولا disagree? طيب. In elderly, we're discussing bladder prolapse, catheter drainage, prostatic enlargement, especially in male. شو بتعمل prostatic enlargement؟ هلا how many we know the natural history of a prostate مش هيك؟ With age your prostate will enlarge. It's inevitable. Is that clear? We will all as males get a prostatic enlargement as we normally age to 60s, 70s and 80s. That blocks the normal urine flow. When you have a stagnation anywhere in your body, or اليوم كانت تمطر في شوية مي as usual, صح? Leave it for a few days, the color will turn into green, and then some flies will come out of it, they will hatch, they will have fun, and they will come out. Check? So we'll have more bugs to season our life. Right. Similarly, the bladder will be blocked, the drainage is inappropriate, any stagnant urine is an inviting environment for bugs to grow, multiply, and so on and so forth. E. coli continues to be the most common. هلا بنحكي احنا على asymptomatic bacteriuria خاصة especially among pregnant ladies. I will discuss it here in a minute. Renal damage, we've discussed it. Females, and renal infections, and the structural and functional damage. So this is the epidemiology and the natural history. We've sort of talked about it, so you can read through this slide. Nothing to memorize. Is that clear? And think of today's talk as more general information, so we would understand how we get a UTI, despite the robustness of our immune system and the functionality of the urinary tract system. But just to understand. هلا نيجي على pregnancy. Pregnancy, we've said once before, I'm not sure in front of this audience or others, we said pregnancy ought to be what? Planned. Planned pregnancy. ليش planned pregnancy? What's with planned pregnancy? What's the difference between planned pregnancy and unplanned pregnancy? شو الفرق؟ ها؟ نعم؟ Needles? Needles? Planned. Planned و unplanned. يعني بتيجي على مرتك بتكون معك needle بتقولها planned ولا unplanned? And then she decides whether planned or أحسنتي, yes, شطورة, بتكون ماخذة folic acid. So the story is much simpler. Thank you for your contribution. Story is much simpler than what you think. It's a wife and a husband would sit down and discuss the possibility of conceiving a new life to earth, and then they would agree that they want to do so. And part of their plan is that they would have visits to the clinician. They would start taking her vitamins to support her body and to make sure the outcome of a healthy baby is more likely, including folic acid, iron, and part of the parenteral visits, okay, بتكون ايش? Screening for positive cultures of possibly of urinary tract infection. A lot of females بيكون عندهم UTI بس asymptomatic, without any symptoms, it's not bothering her, she doesn't know about this, تمام؟ فإحنا part of the planned pregnancy is that we screen for many diseases, and we support the lady with vitamins and minerals, and we also provide emotional support. This way, we are hedging our bets, if you will, that we will get into a healthier outcome, especially when the baby passes through the birth canal. عرفتوا؟ هاي ال planned pregnancy. المش planned pregnancy شو يا دكتور؟ طيب بتكون the lady is living her life بشكل طبيعي, and all of a sudden she misses her period, and she doesn't know that she missed her period. Or 2 months down to, she just woke up and decided, let me go get checked. I haven't got my period in 2 months. Okay? بعدين بتروحوا, congratulations, you are in your second month. You are 8 weeks or 10 weeks into your pregnancy already. Passing what? Passing the teratogenic period, the most critical period in pregnancy, in which, in the teratogenic period, the organogenesis takes place. مش هيك? The differentiation of different organs. فإذا المام أو جوزها أو اللي حواليها بدخنوا, for example, or they drink alcohol, or she's taking whatever, okay? The baby in the 6 to 8 week teratogenic period, okay, was exposed to all these chemicals and toxins. Number 1. Number 2, the preparation. Number 3, screening for all different diseases, including asymptomatic UTI. صح? Number 4, شو? Vitamins or supplements that she've lacked. Do you know how before? 2 months prior, she needs to build up her folic acid and iron. 2 months prior to discussing the possibility of getting pregnant. But there's a lot of preparation, a lot of things that needs to take place. You know, avoid the toxic environments, smokers, إلى آخره, تمام? All of these things pertains to هالكلمتين كنا نحكيهم. وين راح؟ على pregnancy. Asymptomatic bacteriuria requires therapy, requires prophylactic antibiotic, so we'll have a healthy outcome. لأنه you're looking at complications during pregnancy and options to reduce the risk. Okay? Usually I would not ask you pharmacology on my questions because I'm more into microbiology. So please keep that in mind when you look into my slides. So this is the story with the risk factors, the anatomy, who gets what and why. And I hope now we've built a general understanding, a more mature, more deeper understanding of UTI. بس هذا المطلوب اليوم. يعني I think it's an easy task. صح؟ As I said, in order to colonize, to ascend, and to adhere, صح? And then form a biofilm and invade and hopefully arrive to the kidneys. That's the prize. تمام? So these are the different stages that a bug would typically go through to establish a successful pyelonephritis, if you will. Okay? So the ability to colonize, adhere, attach, and then form a biofilm. What's with the biofilm business? شو البايوفيلم؟ هلا كله مفهوم بجوز. البايوفيلم شو البايوفيلم؟ حدا فاهم شو البايوفيلم؟ شو البايوفيلم؟ It's layers of microbes on top of each other. صح? With an extracellular matrix. It's a fortress, if you will, in which if you give it antibiotics, the antibiotics will come to the outside surface, try to clear it from the outside, and when the antibiotic is finished, 5-day course, 7-day course, مش هيك? The inner part of the biofilm reveals viable, active, and represent a source for recurrent foci of infection. And then we're dealing with recurrent or persistent infection. لأنه حقيقة infection never went away, okay? It's hiding within this biofilm that makes the antibiotic and the host defenses كمان harder to reach and get rid of. تمام؟ The worst case scenario you're dealing. طيب وين يا دكتور بنشوف البايوفيلم أكثر؟ باليورو epithelial cells ولا on a urine catheter؟ On a urine catheter. أحسنتي. Yes. Because it is much easier for the bug to attach, adhere, and colonize into an artificial thing, such as the material of a urine catheter, unlike the uroepithelial cells, اللي فيها a lot of the innate and adaptive immune responses, اللي I'll show you in a slide in a minute. Okay? So here, we're discussing a flavor of the different adhesins that the E. coli, the uropathogenic E. coli expresses, type 1, B. Fimperia, type C, G. Fimperia, M. Fimperia, type 3 Fimperia. Here we're diving into something we call molecular microbiology. Something you shouldn't be worried about. No, I will not ask you to memorize any of this, but we should understand, adhesion, لما أنا أحكي adhesion, it's not even the same among the same microorganism. There are different adhesins that are actually a gene that have been transcribed, translated into a protein. It undergoes post-translational modification. It's active, and then it conducts its function. تمام? But even within a same UPC, the uropathogenic E. coli itself, there are different adhesins that get deployed in certain times, and there are certain genes responsible for them accordingly. Okay? And in which they bind to. What is that receptor? تمام؟ يعني E. coli ماشي بتعمل infection. it faces a urine catheter, then the adhesion that will be expressed, translated, and packaged to attach to the receptor على الcatheter is definitely different from uroepithelial cells. Okay? Depending on the pH, depending on the environment. So there are different adhesions, a stockpile of weapons, if you will, that have been expressed and utilized very efficiently, by the way, for the bug, depending on the receptor. تحفظوهم؟ تحفظوا الريسبتورز؟ شو؟ طبعا لا طيب ماشي good. So what we're looking at here is an E. coli. You have the pili here, okay? You have the toxins and the adhesins and the curli and type 1 pili and the lipopolysaccharides. So you're looking at all the virulence properties that you can think of that are represented on the structure, on the surface of an E. coli. To me, at this stage, just know, يعني بس اعرفوا انه this is a virulence property وكثر ألف خيركم, okay? يعني if I can just bring in a very simple MCQ, what are the virulence properties of E. coli? And I mentioned a bunch of them, and I hope you can catch up. Curli, Fimbiria, things like that. Very basic. And this is what we are introducing to you. Lipopolysaccharide and some of the secreted toxins. Amphipathic properties, as you know, تعرفوا ال LPS مش؟ دارسين ال lipopolysaccharide? It has the amphipathic properties, yes? Okay, and it enables to colonize and evoke the innate adaptive immune responses. And sometimes it's one of the strategies of a bug when it enters into the host to inflame the immune system. Because as it is inflamed, in addition to the chemokine cytokine storm, بيكون في extravasation of fluids. But when that happens, the tight junction between the cells loosen, makes it much easier for the bug to establish entry into the cell, okay? So LPS is utilized in that fashion. Imperial adhesins, 4 types, as you can see here. And the sac secretion system. ما راح أسألكم عنهم هدول. Just read through the slide, okay? I will not really question you on this. لأنه هذا more molecular microbiology. I'm more interested into the medical microbiology, so you will know. But just for fun, يعني look at the different types and look at how many proteins are involved to be transcribed, translated, and come together and join together to form the structure that can help the bug establish an infection. Okay. This is a dendrogram, duplicated distribution, familiar profiles by source group. So the different profiles and the different adhesions that exist in the genome of the E. coli. Type سؤال. Would E. coli express all of them all at once when established as an infection? The answer is no. That's inefficient, okay? The energy efficiency. So it establishes an infection. It has all these weaponry as genome, as DNA. صح? Few selected will be expressed and translated, transcribed and translated, okay? Not necessarily all of them. But this just to give you an idea about the different adhesions, and this is why, I guess, E. coli, the uropathogenic E. coli, is the most common cause of UTI. لأنه the name of the game in the urinary tract system is attachment. Attachment and adhesion, صح? But maybe other microorganisms are unable to attach as efficiently, as robustly, as with the different types of attachments that E. coli has. واضح? So this is the tropism of E. coli to the urinary tract system. Curli, appendages, monomeric proteins, okay, and it attach and it helps curli to not only attach to the uroepithelial cells, but also attach to each other as they start forming the building blocks of their fortress. اللي شو سميناها؟ biofilm. So curli ممكن أسألكم biofilm formation and adhesion. صح؟ ماشي. Iron acquisition. هلا iron acquisition is a very old story بصراحة. All microbes, including, we're not microbes, but all living beings, we do not synthesize iron internally. صح? We have to acquire an iron from nature. And just like any other living structure or circle, there is the chelators, the pseudopores, the iron chelators, that requires to pick up the iron from the host and use it for its own metabolic pathways. Yersinibacterian and the other two, Aerobacterian, they scavenge the Fe3, the ferric iron. هاي النقطة مهمة لأنه انذكرت before in board exams. This one right here, okay? The pseudopores pick up the ferric iron, the ferric form, okay? Secreted toxins. The toxins normally would destroy the tight junctions, the surrounding structures, red blood cells, so to acquire some nutrients, and so on and so forth. Well, host defenses, this slide is duplicate, as you can see. So I've showed you this slide before. So this is the host defenses. Okay. فحكينا احنا على اليورين صح؟ So osmolarity, pH, acidity, the flow itself, the activities, the innate and the adaptive immune responses, all the way to the humoral immune and the cell-mediated immune response. Prostatic secretion is also helps in males as well. So all of these factors helps the body. This is a summary, if you will. So what we've discussed here, we summarize the different factors, immune and non-immune factors, that helps the body fight off an infection. Right. So the story of a bacteria. So let's start here and then we'll go back. We are here and then we go back here. تمام? So a bacteria needs to get into the uroepithelial cell. Okay? The uroepithelial cell will fight back. It has its own defenses. Okay? So in the bladder, for example, okay, there are different layers and there are different macrophages. لهم اسم. لأنه they are different. They express certain receptors مختلف عن الماكروفاجز اللي in the lungs, for example, alveolar macrophages, صح؟ تمام. So they interact and they try to prevent the entry through antibacterial defenses, tight junctions, trying to prevent the entry of the bug. So the bug normally is internalized into fusiform vesicle, exotisodes the physical, okay, back into the lumen of the bladder, and then through this channel, through this calcium channel, triggers the expulsion of it. The factors that are responsible for it, antimicrobial peptides, proteins, and chemokines, there are soluble factors secreted by the bladder epithelial cells to help get rid of it. آخر إشي, the last resort in this fight, اللي هو exfoliation. The last resort is to exfoliate, and that's when we see manifestation. شو بنشوف manifestation when there is exfoliation? شو بصير بالurine color? It changes, it becomes dark, possibly pinkish, تمام? Smoky urine is another word for it, صح؟ فهون احنا بنعرف انه not only there is an infection, but there's also an advanced infection. The story, the bug trying to get in, the body is defending against. Okay? The bug adhere, colonize, form a biofilm, and tries to get in, and the body fights back with many, many factors that we've listed. Well, I think this is all what I've discussed today, صح? Read through this. I hope you find it beneficial and depicting what's in the image here. وكملنا. Vaginitis and herpes نعمل culture. إذا bacteremia more than the magic number هون اللي أنا ما راح أسألكم عنه بس راح تشوفوه خاصة بالasymptomatic bacteriuria among pregnant lady اللي هو 10 to the 5, 10 to the 7. Okay? Pyuria على الأغلب urine culture. If it's less than 5, you have unknown chlamydia and others. Okay? Management in my opinion is supportive, preventative, and if the infection actually takes place, then you give an antibiotic. Okay? Well, antibiotic is age-specific with its own risk factors, especially among pregnant ladies. Trimethoprim sulfa is the drug of choice among adults, for example. طيب بنعطيه للأطفال؟ ما بعرف. I'm not going to discuss this. But my point is, إذا اليوم إحنا we've discussed UTI in its general principles, the virulence properties, the host defenses, including non-immune host defenses, and how a bug could possibly successfully establish an infection, okay, all the way to exfoliation. Exfoliation of the bladder uroepithelial cells. All of these, in my opinion, are fascinating. I hope you benefited from the resource session today. What I request from you, because I displayed a lot of their secrets today. What I ask from you is to see how many among your family member household have experienced UTI, and what are the things that you can do, play a role, okay, as a healthcare advocate, inshallah professional in the future once you graduate, to prevent UTI, صح? The following 3 talks will be more specific with more rich microbiology content. اليوم كان more general, introducing the general terms of urinary tract infection. When my thumb drive, I was told, my drive was here, my flash was here, or one of the guys picked it up, one of the students, and it disappeared. I just want the content. He can keep the middle. عليها kangaroo. Huh? لا. One of you حكى one of the students took it to أساس he will get it back to me. Anyways, I will give the slides to Dr. Khalid, so he will disseminate the slides as well. Thank you, everyone.